Hello, today we're doing a class 2 filling using Equia Forte HD from GC. We're gonna need the following materials: a consultation kit, polymerization curing lamp, wedges, matrix, clamp for matrix, rubber dam, and the instruments to place it, the instruments to place the clamp for the matrix, the clamp for the rubber dam, cavity conditioner. This one is from DMG, but you can use the standard GC1 denting conditioner, and the Equia Forte coat, which we'll use to increase the aesthetics and the strength of our restoration. So let's begin. I have the cavity prepared right here and the dental dam placed. Ideally, you will want to place the clamp for the rubber dam on the tooth right after the tooth you need to make the restoration for, and also include a few teeth before the restoration. This will make the placing of your matrix and access to the cavity easier. So let's begin. You'll need a sterile clamp for the rubber dam, obviously there is no problem in placing the rubber dam on this model, but placing it in the mouth and making it sit in this position, it's a bit more challenging. So let's take our instruments. What you need to make sure is that you have the rubber dam properly seated on the tooth we need a preparation for. Once you have that checked, it's time for us to place the matrix. Also sterile. Once you've placed the matrix, be sure to choose a proper wedge for it. And place the wedge very gently. I'm using some wooden wedges here, but there are several alternatives you can use, including plastic ones. Okay, and now we need to secure the wedge and also the contour of the tooth using this clamp. As you can see, this forces the matrix around the tooth. Let me show you a bit closer. Okay, so now the contour will be better, the adaptation will be better. Always, no matter what matrix you use, burnish the contact point, always, with a ballpoint instrument. This will ensure a proper contact point. Okay, now we need to condition the cavity. We can do this using also a sterile cotton pallet with the dentin conditioner. I'll be using a smaller amount as I'm not near the chair and I can't rinse the cavity properly. So make sure every surface of the cavity is conditioned. In the deeper portions you can use carefully an explorer like this. Okay. Now we'll need to rinse the cavity. You rinse it with your chair's air water syringe. I'm using a glass here. And use a cotton pellet to dry the cavity. Do not over dry it. Also, if there is a proximity to the pulp, be sure to use a glass iron or cement. Once I have my cavity dry, not perfectly dry, a small amount of moisture needs to be there. The dentin needs to be moist. I'll take my capsule, mix it. So I have my capsule mixed. I'm using some barriers for the capsule gun, not to contaminate it. 1, 2, and the third one needs to be in the cavity, and I'm dispensing be sure for the tip of the gun never to leave the cavity. And I'm using a cotton pellet to spread the cement evenly. On the margins. And also my spatula for the edges. And we wait for it to dry. For a few minutes. After the cement sets, you can finish the obturation using an Arkansas stone or some finishing discs, and in order to strengthen it, we'll apply a layer of Equia Forte coat. This will make the restoration a lot more durable and prevent it from failing. Cure it for at least 20 seconds. And that's it. Obviously you need to check the contacts, but this being a model, we don't have any contacts, opposing contacts to check before applying the coat. If you have any questions, use the comment sections below. Thanks for watching, and be sure to check out our other videos.